Okay, welcome everyone. My name is Sharice Maynard. I'm your moderator for today. Today we're going to be discussing cyber resilient EHRs and how we can take this whole idea through 2025 and into the future. I'm very excited for the guests I have today. I have a great deal of respect for everybody on this call. So I hope you guys enjoy the presentation we're about to give you. First, we have John Lynn, founder of Healthcare Scene, one of the most respected voices in the health IT space, and someone who's been tracking EHR transformation since before meaningful use was even meaningful. And from Fordewind, we have Vlad Broyd, a gentleman I just met this year or at the end of last year, who I think is just absolutely fascinating what his company's trying to do in the healthcare space. He's a cybersecurity strategist and is behind EHR Cybersecure, one of the solutions we'll probably talk about a little bit today. Last, we have David Levine. Oh, was it Levin, David? I'm sorry.
Levin.
Okay.
Either way's fine.
So David is actually, I've been calling him my partner in grind lately because we've been working on this EHR cybersecure project for a minute, and he is now the stateside or the USA leg of Fordewind. So are you guys ready to get started?
Oh,
yeah.
Okay, so let's begin with some context. According to IBM's 2024 Cost and Data Breach Report, healthcare breaches are now costing an average of $11 million per incident. What's worse, 83% of those breaches target patient data. Already in 2025, we're seeing incidents increase due to the uncertainty of healthcare regulations. I'm seeing this and I'm getting more calls from my clients about how to be more resilient or how to build better security strategies. So, John, my first question is for you. Can you kick us off by helping the audience understand why healthcare is such a rich target for cybersecurity threats?
Sure, definitely. I mean, what's funny is that healthcare has always been a target, but I think it's become more of a target because now more of the healthcare data is available electronically. Even 15 years ago, most people hadn't implemented an EMR, so the data wasn't there available to them. Sure, there were some IT systems and things, but the healthcare data itself hasn't. So there's this amazing healthcare cocktail, which I know Sharice will appreciate this analogy. That there's this cocktail of things that have happened in healthcare that make it so valuable. First off, is it has data that is extremely valuable. People think credit card data is valuable, not even close compared to healthcare data. You can do all sorts of things. If you get that data, you can, do identity theft. You can do Medicare fraud, medical fraud. You can do all sorts of things with that data, which makes it more valuable. The other thing is that healthcare is an easy target because healthcare is everywhere. There's healthcare systems across the nation and across the world, quite frankly, that all are storing this information electronically now. And so it's an easy target that's often underfunded. And then you also look at it and say, well, why is it so easy? Why is healthcare maybe easier to breach and easier to get access to the valuable data than, say, a financial system or other system, which has valuable data as well? And the answer is that, one, we have outdated systems. Many of our systems were built, and one in particular was built the year I was born. So it was born the year that I was there, right? And so that's an interesting challenge. The second one is that we have multiple systems. I mean, even a small hospital system has easily hundreds and hundreds and often thousands of systems that they're managing, which is why many of them are outdated. They can't even get to them to be able to update them. And then the other is that we've actually encouraged sharing in healthcare. Banks aren't like, hey, let's share with each other. No, we have a very finite thing that we'll share in a very finite way. Whereas in healthcare, we're saying, no, you need to share the patient's data with whoever needs it because that's what's best for the patient. And so, sure, that is the right thing to do for the patient. But when you do that, when you connect all of these disparate healthcare organizations, you're creating this risk surface that is so wide and so complex that there's lots of opportunity for bad actors to come and breach those systems. So to me, that's the healthcare cocktail. This amazing data that everyone wants to breach, and also a complex system that is easier to breach than many other areas. You're on mute, Sharice.
Oh no. I always say that we're in a hell of our own making, just to your point of what you're saying. When I think back, I always laugh at how we used to say, don't share the data. And now we're saying, make sure you're sharing all of the data as we try to perfect or increase the likelihood of being able to share information in the healthcare space. So my question to you, John, would be if you had to describe resilience for these bills, what would it look like to you? Because I think if you ask anybody, everybody will give you a different answer. But what to you is resilience?
Yeah, I mean, there's so many elements to resilience when it comes to security. But here's the fact that people need to understand. We are not in a state of if you will be breached. I think we're in a new environment where it's when will you be breached. And so we have to own the fact that every healthcare organization is going to have breaches. And so to me, resilience is about when you're breached, what are you going to do? One, are you going to detect it quickly? That's the first problem, right? Do you actually know that a breach occurs? And we've seen examples of this where many healthcare organizations went years not even realizing that they were breached, right? And so, do you have a culture in your organization of realizing that a breach has happened? Or have you made everyone paranoid that if they download it and click the wrong link in their email, that they better hide it because they're going to be punished for it? Or do you have one where if they click the wrong link and a breach happens, and they download some malware or whatever it might be, that they're willing to share because that's part of your culture? That's an example of detection, right? And creating a culture that allows for detecting that the breach occurs. The next is I look at is recoverability. Okay, now that a breach has happened, what are you going to do to recover? Do you have an effective plan so that you can recover quickly, so that you can go to backup sites, that you have backup processes that are available? So how quickly you can recover is the second step for me in resiliency. And then the third one I think about is continuity. Which systems do you actually need continuity on? Because not all systems are created equal. You have to risk stratify the different health IT systems that you have and be able to evaluate, hey, are these mission critical ones that I need to up as quickly as possible? Or are these systems that maybe don't need as much investment because if they're down for a day, that's okay. And so, that's how I look at it, is say, I need those three things. I need to detect when a breach happens. I need to be able to recover quickly, and I need to understand what continuity is needed for each of my systems. Because, hey, it's great if we secure everything, and that would be great. And we should stop as many bad actors as we can so that the breaches are held to a minimum. But the reality is breaches happen. So we have to be ready for, ensuring continuity of care for our patients.
That makes absolute sense. So, Vlad, I would ask you in your environment, because you're building these systems, how would you define resilience in your builds, or how would you define it if you're building one of these EHR systems? You're on mute.
Okay, yeah, sorry. Yeah, of
Mhm.
course, in EHR cybersecurity, we covered all these aspects, and we have, frankly said, we had two biggest approaches here. We have a proactive and reactive mechanisms in our system, and of course, for proactive side, we apply a strict role and context-based access control. What does it mean? For example, a cardiologist doesn't see what a surgeon sees, and no one sees anything without first validation of their device, session, and location. Of course, we doing MFA for sensitive actions, using just-in-time access for that expires automatically, and dynamically mask sensitive data like lab results and prescriptions unless access explicitly granted. For reactive mechanism, just what we just discussed, absolutely important thing. If we detect that somebody get access from unusual IP or starts bulk accessing patient records, we flag it instantly, and sessions can be terminated automatically. User or admin can take immediate action through the built-in security center. So everything is for the sake of resilience and safety.
Okay, so let's talk about your containment features. I think that from the standpoint of getting the threat in real time, like you said, instantaneously is of great value. But how do you contain those threats that you're seeing?
Sorry, repeat, please.
How do you how do you contain things? How do you detect things in real time and instantly the way you have stated? And what does that look like? Containment.
All right. Just a very, very important aspect of the system. It's cybersecurity in EHR cybersecure, covering key functions of NIST cybersecurity framework. It's definitely protect, detect, respond, and even recover. So as I just told, like the first thing is we identify users, and we identify devices, context like role, location, session history, before even granting any access to the system. We also implementing just-in-time requests that are closely tied to purpose and expire automatically. Then we have a protect. It's about controlling access and safeguarding data. All patient information, of course, encrypted, both in transit and at the rest. And sensitive fields absolutely stay masked until it's verified. So nothing sensitive is exposed by default. Another thing is very important is detect. So our system continuously analyzes behavior. If someone starts opening dozens of unrelated charts or logs or whatever, or from strange location, for example, so it's flagged immediately and trigger adaptive MFA for re-verification of the user. Respond kicks in through automated playbooks. We can isolate features, terminate sessions, alert admins, and even let users take actions themselves, like by pressing special buttons if they have any suspicious activity on the screen, maybe it's a virus or whatever. And finally, recover, what John mentioned. We're logging every action. If anything goes wrong, we can roll back access and restore safe system state fast. That's, by the way, that's zero trust in action.
I was about to say all that aligns with the gold standards for right now. Definitely the zero trust framework. So let's talk about frameworks, guys. For John, these aren't just academic, these frameworks we talk about, they are the new guardrails for digital health. How have you seen how have you seen zero trust implemented over the last few years? Or what are you seeing?
Yeah, I mean, I think there's an interesting thing that's happening that many healthcare organizations have realized we shouldn't do this alone. Right? Like when it comes to security, we can be as friendly as possible, and we should collaborate together, and we should fight against these bad actors in a unified manner. And so I think there's two things. There's frameworks that are interesting to healthcare and useful for healthcare, and then there's technologies. I would actually consider zero trust to me more of a technology approach. and a technology solution. Granted, it can be applied a lot of different ways across a lot of different, technologies in healthcare, but zero trust is a technology. Two-factor authentication is a technology that's very useful in thwarting some of these threat actors. Both approaches are great at prevention. It's great at preventing insider threats, the zero trust frameworks that don't allow the insiders the opportunity to have access to the data. I think those are amazing. There's, Vlad talked about some of the technologies they have to help you detect and help you, identify any issues that are happening so that you can protect yourself. These are the technologies. And then to me, I look at the frameworks more like the NIST frameworks, or even, there's a really popular one, 405D, which has become really strong in healthcare, and a lot of people are advocating it. And it was designed to work for smaller healthcare organizations all the way up to the largest healthcare organizations. And these frameworks are beautiful because the question is, how do I secure my healthcare organization? And the thing they're always asking is, where do I start? There's so many challenges. And to me, my answer to them is use the frameworks, start there. And these frameworks aren't just frameworks. I actually describe it, especially ones like 405D, I describe them as shields against liability. Because when you look at the liability of healthcare organizations when a breach happens, if they haven't implemented good HIPAA policies, if they haven't followed a structure of 405D, then they're at much more risk of fines, of lawsuits, of other liability that could damage their organization. Whereas if they have implemented these and then something happens, they have some shield against the liability they could face. Sure, like there are still risks. There could be potential fines whenever a breach occurs. But when an organization has made a good faith effort to try to secure their organization, then what we've seen is that the regulators that impose these fines are actually much more lenient. They usually want to go after the egregious people that are doing stuff over and over, that knew that there was a breach and did nothing about it for years, right? So they're usually going after those that know that there's a problem and haven't done anything about it, as opposed to those that made a good faith effort to try to implement the best security possible, and then just a breach happened because, we have to be right every single time. The hacker only has to be right once. And so sometimes the hackers are going to get through, right, and breach your system. So that's what I love about frameworks is, one, it gives you a starting place to understand how should I secure my healthcare organization, but then it also gives you at least a plausible explanation that you made a good faith effort to secure your organization. And I think both the patients, appreciate the fact that you made these efforts, and the regulators do as well.
I agree with that. I think one of the things that I still continue to see is that leaders still have a reactive or reactionary thing they do. Is like, if we get hacked, we'll take care of the problem, that type of thing. So what do you think is like the biggest barrier, cultural wise or whatever, to implementing a NICE or full zero trust, any of those type of frameworks? What are you seeing?
Yeah, I mean, I actually think that the real answer to this is resources. Many organizations just don't have the resources. Turns out they're competing with all the other industries to get high quality security professionals at their organization. And many of these healthcare organizations are in rural environments where a security professional doesn't want to move. And so I'd say that's actually probably the biggest challenge. Even when a board of a healthcare organization comes to them and says, hey, security is a priority, here's a blank check, which they never really say blank check, but nearly, right? They say, this is a priority, how much is it going to cost, right? Which is the kind of blank check in healthcare. And so when they do that, many CISOs and CIOs look at it and say, hey, I can't even hire the personnel that I need to secure this. So what does that mean? What that means is they have to rely on partners. They have to rely on vendors, outside vendors that they can partner with as true partners in their security efforts. And so I'd say that's the biggest challenge we have, is getting the right security personnel available to be able to secure healthcare. And then also, there's, the other challenge related to that is that there's so many things happening in healthcare. I mean, AI is the biggest shiny object right now. And what would you rather do? Would you rather work on a security project that if you're successful, nobody hears about and nobody knows about it? Or would you rather work on an AI project that has all the flash and bang and makes people's lives easier and they see how automated it is and they see the revenue increase? Like, you can understand why security doesn't get the attention it needs because if you're successful, no one knows. Whereas in AI, if you're successful, everybody knows because now I don't have to do that annoying process that bothered me forever. So I think that's the other challenge we face in security is, there's so many shiny objects and security is a challenge.
So Vlad, I would ask you the same question from your point of view. What are some of the barriers you're seeing to getting these solutions into the right hands? And then let me give a second part to that for Dave, because you're responsible for marketing and getting these things out. What are you seeing as also barriers? Well, let's start with Vlad.
Yeah, and just want to add to what John told that, of course, what is interesting from my point of view and my perspective as an IT specialist and an engineer at the first hand, we have for a long time we have these challenges for security in different industries, and of course they are also very crucial. And when healthcare IT started booming so fast in the latest period of time, so we bring all this experience into the healthcare industry, and not only experience but also technologies, approaches, of course, based on those standards and frameworks that are usual in healthcare. Yeah, but for me, it's very important to convince all the healthcare people actually to use all this experience, because it's all already in our hands. We can do the things that we did in different industries. The question is just like openness and willing to adopt all these things in healthcare IT. That's my opinion.
Okay. And David, what would you say are obstacles? You're on mute. David, you're on mute.
Apologies, everybody. I would boil it down to one thing. Primarily it's, if it doesn't happen to you, then it's not a problem. It's, if you're reading about it in the newspaper, well, that happened to the other person or whatever, the other company. So it's I think a lot of companies out there, and not just in healthcare, I think just generally when it comes to cybersecurity, have more of a reactive approach as opposed to a proactive one. But then, of course, when they get hit and something terrible happens to them, of course, then they're like trying to figure out what to do and, how to prevent it the next time. So again, I think it's a question of, did it happen to me yet or not? And if it didn't happen yet, then it's not an urgent matter. But when it does, then of course it becomes one.
Okay, so let's look at some examples. I hope you guys have some examples. John, do you have an example of maybe an organization that's doing this well, or have you seen anybody implement some of these frameworks and really make it work for them?
Yeah, I think the interesting thing is that technology is not the hard part. The hard part is actually culture and creating a culture of security in your organization. And by the way, that starts at procurement. When you're procuring an app and understanding that you're securing it, it includes training, it includes messaging. Charisse will love this. It's more of a marketing challenge than it is a technology challenge. And how do you market the need for this security and this culture of security in your organization? But one of the best ways I've seen this happen is organizations that decide to do a tabletop exercise. So that's literally, let's get all the leaders in a room and let's act like the breach has happened. And you walk through, what would you do if a breach occurred to XYZ system, in many cases your EHR system or some other primary system. And you walk through, okay, what are the steps we're going to go through once a breach occurs? And what I love about that tabletop exercise is it opens the eyes of the leadership in ways that you would have never seen before. So now that once they've been through a tabletop exercise and they realize, oh dang, we do need that system to do XYZ. Because if we don't, I'm going to feel that way. I'm going to feel insufficient to be able to tell them, right? I need the audit logs. I need the tracking of what happened to the breach. I need to understand, how the breach occurred. Because if I don't, how do I go to the PR and to the press and tell them what's happened? So, I think that's one of the best things I've seen is people who do the tabletop exercise to say, hey, a breach occurred, and how am I going to feel when that happens? And that changes the culture so quickly in an organization because it teaches them, hey, investing in avoiding that that breach is worth it. So that's number one. And number two, if a breach happens, I want to be ready with the right tools, the right systems, the right backups, that are available. So anyway, I think the tabletop exercise is a great one. Other, related to that is, have you tried to restore a backup before? Like, it's great that you have a backup, but have you ever tried to restore it? Well, that becomes a problem when a breach happens and then you're like, oh, let's see if this works, right? And if you're not sure, I know as an IT guy, I've tried it before, and like even doing the practice of restoring a backup is scary because you're like, what if this doesn't work, right? So I think that's another example. People that do that illustrate that they actually are proactively care about the continuity. So, and the last thing I'll throw in there is that, do staff know what to do in the event of a downtime? Like, how are they going to react when, your EHR is down? Ironically, I had this happen to me. I was, working IT still at a medical practice, and the EHR went down. And I started to freak out, of course, because I'm responsible for the EHR and it not being down. But we'd actually gone through this. We had our plan. And luckily, the director of the health center was there. And she was totally calm. She said, that's okay. We know what to do. Here's the plan. Do it. And they went to, and they started executing, and it diffused the stress of the situation. Sure, it was annoying that we didn't have access because we become so reliant on the technology. But because we had a plan, the leader executed that plan, it diffused the stress of the situation. So, making sure staff know what to do in that downtime can be a very powerful thing as well.
Interesting. So Vlad, walk us through one. Walk us through a breach scenario with your product.
Of course. Just a simple example of scenario what's happened during our actually table talks and then the discussions how our system is behave in a case of any accident, let's say. Imagine a staff member logs in from an unrecognized device in an unusual time. It's a very often situation. Right away, our system applies identify and detect, analyzing device trust, geolocation, and behavior patterns. If something looks off, our system flags it, restricts access to only low sensitivity data, and send an alert, mapping directly to detect and respond functions. Then an automated incident playbook kicks in, access is isolated, sensitive records are blocked, and user must verify identity via two-way of verification, MFA, or just ask admin to approve his access. Of course, all actions are logged in real time. We have all the logs stored. We can check later what happened and how to prevent it in the future. And yeah, this is how actually, again, what I can say, zero trust in action, never assuming trust, always validating on every step of activity in the system.
Okay, guys, let's take a question from the audience. Let's see, let me pick one. How do we balance clinician workflow with strong cybersecurity frameworks without burning out our physicians or introducing more friction? That's to all of you. Who wants to go first?
Sure, I'll take it. It is interesting, right? We say physicians are burnout. I think all of us are burnout. Like, I think that there's a lot of overhead right now for a lot of us, right? And unfortunately, in many cases, security and usability feel completely at odds with each other, right? That hey, if I either have to have security or I have to have usability. Now it turns out that's not always true, but let's use the macro case. If your EHR or health IT system that you need is down, is that a very usable system? No. So if you don't manage security and you don't have access to that system, then you have the worst usability ever. And there's no frustration worse than not being able to access your system. So, let's start there. But it turns out if you build the right security in, zero trust can actually make it more usable. Things like biometric authentication can actually make it more usable because the login happens so quickly that they don't even notice it. It just becomes part of the habit of what they do, right? Even look at password resets. One of the most annoying things for a user, right? And you look at it and you're like, why? They have to remember their password, they have to reset it. But for good reason, we have safety protocols in place to make sure that someone can't just call up the help desk and reset Sharice's password and get access to all their information, right? Like that's a security breach issue, right? Well, there's solutions to that. You can do password reset that sends them a text to verify that that is indeed the person that has access to that login. And then you can make the reset happen in a usable way so that happens quickly. Most people know that it's their fault that they forgot their password, because they had to reset it too many times. That's a whole nother topic for another day. But if you make it easy for them to be able to reset it in a trusted way, then security doesn't have to be at odds with the burnout that they feel. You're on mute, Sharice.
Of course I am. Vlad, what would you add to that?
It's a very interesting topic, by the way, because what is happening? We are users of many applications and systems and platforms, and we get used to very simple authentication and useful ways to have an access to the systems. And when we come to our working place and use some other systems that are, let's say, outdated or not so modern, we are very frustrated with unusual ways to like reset the password, get the access, all the things together. And of course, security also under the pressure in this case. What we are doing in our system, we are using the modern ways of authentication. We are getting devices, trusted devices, geolocation. We are receiving all the modern ways to get access to the system without an annoyance of old-fashioned ways like this. And security is also winning in this situation because all this ways of authentication is very, very modern, secure, and there is no ways to get breached in this case.
So I had a conversation with a organization yesterday about this idea of burnout, and much to John's point, maybe it's not burnout. Sometimes what we discussed was like maybe it's something different, maybe it's friction or how technology that we're all building might be seen by clinicians as another type of bureaucratic type of system. How do we remove that type of feeling from the physician that's using these products?
I mean, when you look at burnout, there's a lot of ways to look at this. My favorite is a study by a BYU professor who looked at the highest satisfaction profession, and you'll never guess what profession that was. Turns out it's zookeepers. Zookeepers are the highest satisfaction profession. And you look at that and you're like, okay, well, why is it? They must get paid a lot. And you're like, wait, no, zookeepers get paid almost nothing, right? Like they're one of the least, worst paid professions out there. You're like, oh, they must have great hours. They must have a great work-life balance. And you're like, No, actually, zookeepers work more than probably anyone because they need to be there for the animals. And so they work long, long hours. So you're like, wait, so the profession that has the most satisfaction works the longest hours, gets paid the least, but they're really happy. And so he studied, why are they so happy? And you look at it and you say, okay, well, why are they so happy? And one of the big reasons is they had a mission and they thought the work that they were doing was meaningful. So you look at that and you say, okay, well, how do we apply this to healthcare and the balance that you're talking about, right? Like, is the work that we're doing in healthcare meaningful? Yes. So we have a similar opportunity to zookeepers because what we're doing is meaningful. So, one, are we communicating that to our employees that what they do matters? And then the next one is like, okay, are we having them do stuff that is actually meaningful, and do they understand why doing that is meaningful to the patient? It goes back to what I said before. It's a marketing problem, right? Have we marketed the fact of why security is meaningful to the patient, is meaningful to the organization, is meaningful to the clinician, who, by the way, they don't want to get their information breached either, right? So, and they don't want to be, suffer under a breach. And so, I think that's where you need to start, which is, how are we communicating how the IT solution or how the security solution or how whatever we're implementing is actually going to help them and help the patients? If we do that, then I think it reframes, hey, the fact that I need to have two-factor authentication on when I e-prescribe controlled substances, because that actually is going to secure the transaction and ensure that people can't abuse drugs. That's meaningful, right? But if I see it as just, oh, this is just IT trying to implement another thing and I don't understand why, that's when I think the burnout happens.
Vlad, would you like to add to that, or Dave?
I'm fine. I'm completely agree with
Yeah.
what just John told.
Okay, so let's take another question. If you had to prioritize one pillar of the NICE CSF, or the one John mentioned, or Zero Trust, which would you say is the most urgent for healthcare right now? That's from the community, so we really have to get into this one. If you could only do one thing, what would you do if you're an organization?
It's a hard question because every pillar is very important. And yeah, we are paying very big attention to every of aspects.
You have to choose children, Vlad. I mean, I would choose respond, right? Because the reality is everyone's going to have to respond. So, Vlad's right, you do have to identify it. You do have to protect your organization. You have to detect when a breach happens. You need to be able to recover after. But to me, it's how you respond, and, that's going to make the biggest impact on the business. So if you're not ready to respond when a breach happens, then it turns out, the damage that's caused from the breach starts to multiply, because now you start damaging your reputation. And if you damage your reputation in the industry and you lose the trust of your patients where they don't believe that you're going to protect their information, then you start dealing with other business problems where they don't want to come to your organization. They go to your competitor across the street. And so, I mean, to me, how you respond can burn your patients and the trust of your patients. It can burn your clinicians, who are, like you said, are already burnt out. And so we need to respond in a way that makes them feel valued and appreciated. So, anyway, to me, Vlad's right. All of them are important, but I'd start with respond.
I should agree. Yeah, maybe if we need to choose one most important, yeah, you're right. Font is it's a very important thing, most important, I believe.
Okay, so let's get into training, because I strongly believe that training, or lack thereof, is one of the biggest barriers to being able to adapt these systems and use them, or making the systems more resilient. So where does training fall in line for you, John, with these frameworks being adopted?
Yeah, I mean, I think the reality is that training really matters to a healthcare organization. I've said this many times on our CIO podcast, but there was a CIO that told me, "Hey, you know what I'm worried about?" And I was like, "What?" And he said, "I'm worried about the 21,000 points of vulnerability I have." And I was like, 21,000 points of vulnerability? What's he talking about? And then he kept talking and he said, "Yeah, I'm worried about the 21,000 people that work with me." Because every person in his organization is potentially a point of vulnerability. So, if every person there could potentially download a piece of malware, could potentially, be phished and offer up their credentials so that now the bad actor has complete access to their systems unabated because they literally compromised the credential of some employee, right? If you do that, that's a problem. And so how do you combat that? The biggest way to combat that is through training the employees. So you train them on understanding, hey, this is a phishing attack. You train them on understanding what that looks like. And you train them even when they respond to one that you sent. And you have to respond in the right way, not in a shameful way, so that the next time they're afraid to tell you about it, but respond in a way that says, thank you for telling us about it. And thank you for showing us, that this was a problem, because that's what's needed. So to me, training them on all of these details is the way you address those 21,000 points of vulnerability in an organization, or in other words, the staff of your organization. Of course, you need layers beyond that. You need technology beyond it to detect when something like that happens, because they may not even understand it. Training is only so good. We're tech experts, some of us here, and I'm sure we've seen phishing emails where we're like, that looks really real, and I might want to check it out, right? And so, the bad actors have gotten so good that we need both. We need to train our staff so they're not, introducing us to vulnerabilities that they could have avoided. And we also need a detection when sometimes they don't realize that they were phished or had some other issue.
So, Vlad, would you like to add to that? We have a question in a second, but I'm interested in your thoughts on that.
Yeah.
Because training, do you believe in a sustained training model, or one and done? What would you say? How do you tell people to use your platform with training?
That's first thing is, of course, the training, especially during the first implementation of any system, new system to the employees. Yeah, it's a very important part of the work. Maybe the same importance as the development of the system. And of course, we are providing all the information, how to use the system safely. And but what I want to add here, that not only training of the employee is important, but also continuous adoption of the system and the user interface, and all the aspects of the communication with the platform is very important, because when we are training on real life. If we're implementing something, we see that it's not working, or working not properly, or somebody can use it in a way that is like not secure way. And in this case, we are trying to cover this scenario and close this breach in the system. And this is also important. So we are not only training the employee, but also training us as the developers of the platform, and improve the platform continuously.
Okay, so we have a question from the audience from Dr. Robert Gergley. Doc, I'm hoping I'm pronouncing your name properly, so forgive me if I didn't. So his question is transitioning to a decentralized medical record system, does it have the potential to significantly reduce, if not completely eliminate, breaches of sensitive information?
Yeah, I mean, it has the potential. Obviously, the bigger the data store, the more potential to be breached, because there's more. It's more valuable if you breach a larger system than a smaller system. So, I get where he's coming from. I know he offers an individual PHR that he does. So, it makes sense, right? If I'm carrying around my own PHR, then I'm reducing the risk associated with it potentially. Now, it does introduce new risks. If I have the PHR stored in my own one, well, then I have to protect it, right? So it doesn't reduce it completely. It just changes the risk for it. But, to his point, if you have a honeypot of high quality health data across millions or hundreds of thousands of patients, right? Then obviously the hackers love that, and it'd be a target for them to breach. So in that regard, it's true. But even decentralizing it just creates a bigger risk surface area so that fewer things get breached, but maybe more, but maybe there's more breaches because individuals aren't securing it properly. So I'd say that there's a give and take. Plus, the other question is, will we ever get to a decentralized one? It feels like we're in a centralized world, and that probably isn't going away. So that might be the other question.
Your thoughts on it, Vlad?
Yeah, I completely agree that it will solve a part of the problems, but we still have the same issue of untrained personnel or personal factor if somebody is just to receive a phishing email and open the access to the wrong place or opens the unnecessary data and expose it to somebody who is not actually need to see it. So part of the problems will be solved, of course, and John is right. We are in a decentralized world now. Everybody is thinking about blockchain and all these technologies, and I really see this potential and future of these technologies. But from other hand, it's not solving for every problem. It just partially solves the issue with data storage, and yeah, and this is it.
Okay, so we've talked today about what the environments look like, but let's talk about how we get to the future of resilient EHRs. What does that environment look like? How do we evolve these systems? Because one of my least favorite things to see is a system that fails to evolve at the speed of hackers, right? So how do we ensure EHR systems going into the future are more resilient?
You gonna start, Vlad?
No, I think you better.
You want me to? All right, I'm fine with that. Yeah, no, I mean, I think at the end of the day, there's one central thing that's required to make sure your organization, your software is secure. And you know what that is? That is actually caring to make it secure. And that's harder than it looks. It's easy to say, yeah, we care about security. It's another thing to actually show it with your actions, with your budget, and with what you do. So I think that's the challenge is that, for a long time we were able to skate along and not worry about it, right? Hey, a little breach of your email system, that sucks, but you're going to survive, right? Well, a breach of your EHR system is a very different thing because now you're talking about millions of records potentially being breached and fines associated with that and reputation and other things like that. So, I think that's where, we should care about it because the impact is so much greater. I always think back to the days like a breach used to be that someone left 20 paper charts in their trunk, right? Like that's what a breach was for a doctor that, someone broke into their car and stole 20 paper charts that they took home to finish at home. It's like, and then it accelerated to, okay, then now they took their laptop home and they had, 1,000 patient records in an Excel file on their laptop. And so now they had 1,000 breaches. Well, now, it's easy to see how someone compromises a whole EHR system when we have hundreds of thousands insurance companies getting breached and, millions of records being breached. And so we've seen this acceleration of how many breaches are occurring. And so, we need to care about this stuff. Because if we don't, then the consequences are damage to trust, massive fines, and it's hard to come back from that.
Completely agree. And for me, it's important to mention that, so security is about confidence and confidence in our tools and the team, in our data safety, and at the end, the right mindset to build the secure software in healthcare, especially.
Okay, Okay, so the final question I have for you guys, and this came from the audience. What if I'm all on board with um, securing the EHR? How do I sell it to my leaders?
The hardest task, right? How do you get leadership buy-in to support investment in security? The nice thing is that we've seen an evolution of that. Before the board didn't care about security, and you could, talk about it till you're blue in the face, and they were kind of like, yeah, but they kind of turn a blind eye to it. I don't think that's the case anymore. I think most boards are aware of the number of breaches and the risk of breach, and they've seen enough of the breaches and things that have happened that now they're awake to it. And so to me, the key to it is telling the right stories and taking the variety of stories that are happening, because they're happening all the time. There's no dearth of stories about breaches occurring. So as a leader, whether you're the CIO, whether you're the CISO in charge of security for your healthcare organization, take those stories and tell those to the leadership. Tell those to the board so they understand the risks associated with it, and the challenges and the costs associated with not being secure. And if you tell those stories the right way, and then you back it up with data from your own organization, and the data is twofold. First is the data says, here's what's at risk if we don't secure. And then the second piece of data you need to bring to get buy-in from leadership is, hey, we implemented this solution, this technology solution to secure our organization, and here's all the attacks we blocked. Here's all the phishing attacks we had on our organization that we were able to detect. Here's all the XYZ, right? Like, how did actually their investment in security produce the results that they want, which is reduce breaches, quicker response, et cetera, et cetera. So you have to provide them the story and the data. And it turns out the data tells a story as well. So combine those two, and that's, I think, your best way to get buy-in from leadership.
Let me add one thing on that also, and I'll just jump on top of what John said. In terms of the story that you want to tell, it comes down to dollars and cents. I mean, we live in a litigious world right now, and the lawsuits fly anytime anything happens these days. And I think, if you show the risk and the liability that you're facing, it's compelling. If you're one of the management team or the board of directors, you're going to want to look at that. So definitely, I would add that, and it's a little bit of a fear kind of approach, and a little bit like that. But I think at the end of the day, if you know that you're vulnerable from a legal standpoint, you're likely to take action to prevent it.
Okay, this has been a great discussion, guys. So as we close out, can you please tell people where to find you guys online, how they can connect with you, John, or your organization, and how we can connect with Fordewind and you guys on your organization?
Yeah, so I'll start. Easy, just go to healthcareittoday.com. You can find all of our publications. We have 5 different podcasts as well, so you can like and subscribe, as the kids say these days. So be sure to check all that out. You can find us on YouTube if you search for Healthcare IT Today. And if you want to find me personally, I like to tell people I'm easy to find. If you didn't find me, you didn't try. So if you just search for John Lynn online, find me on LinkedIn, Twitter, choose X, whatever it's called these days. Even Healthcare IT Today, hit the contact us form. Happy to connect with people.
Vlad, how can we find you?
Oh, same with me. Of course, LinkedIn is the best way to reach me by looking for Fordewind or Vladimir Broide as my name here. And so I always there and respond immediately when you reach me.
Or just on our website, fordewind.io. The other easier and most direct way to do it, for sure.
Thank you, David.
Okay, guys. So I'm Sharice Maynard. You can find me online wherever, particularly on LinkedIn, if you want to have a discussion about anything we've talked about today. I want to thank my guests for coming. You guys are amazing, and I enjoy talking shop with each and every one of you. I want to thank our audience again for joining us, and we look forward to seeing you around the Health IT Playground. Have a good day, everybody.
Thank you.
Thank you. Bye-bye.